The Fort Knox Hospital is actually a 5-state medical area. We're foundation with a hospital, and we have clinics in 5 different states. We support the Army's medical mission there. We do anything from normal patient care, inpatient, to veterinarian and dental services, including warrior transition. The facility, we support over 63,000 beneficiaries in the greater area. But we also support the entire Ohio Valley, industries, food preparations, elementary schools, preventive medicine, public health, things like that. Staff of about 2,200 personnel. The importance of the operations of paper, mainly data for a patient, it's as important as the syringe and the cotton ball is. Without the proper information, our patients can't be treated properly. We've put in approximately 152 devices. They're in the 5-state regions. We're CAC enabled, we're ID secured, and what it has done is we have allowed the stoppage of any of the violations or leakage of patient information, but also decreased our inefficient practices and a lot of our loss of resources. I'm very happy with that. When a staff member goes to print, they remove their CAC card from their local computer, which actually locks it, which is great on another side of IT as a secondary benefit. They go down to the printer, they stick their CAC card in, and it gives them a menu of everything in the print queue. Now, the interesting part is that they do not have to get up and print every time they want a document every single time. They can do it in bulk batches, whatever they prefer. In doing so, we find that a lot of folks don't need to print everything. A lot of it's habit. It also helps because after 2 hours it's deleted if it hasn't been printed. We have done dramatic reduction in paper and toners and wasted time with this. And it keeps our HIPAAs very, very secure. It's critical to support the patients and the security of the system. It doesn't allow a staff member to be non-accountable for the documentation and the information. Everything is done attached to an individual. If an individual goes to a printer and prints it out, we can track it. If they leave it on the printer for whatever reason, there is still a tracking mechanism. We know where it came from. So by doing this, it also raises the conscious level of the staff member to understand what they're working for, what they're working with is not our information, it is definitely the patient's. So now we are really focused on the patient security, which I think is great. The Lexmark team is one of the best I've met. And I say that meeting many, many different vendors and many folks that come to the government and the military for selling their services and products. They've been with us the entire step of the way. It isn't just here's a printer, here's a device, run away. They've been very competitive, but more importantly, it's the relationship. Their business acumen is par excellence. Very nice to hear, considering oftentimes you get folks who will focus on the technology, not the integration of the technology into the businesses where I have to live. I've had a wonderful 5-year relationship with them, and I can hopefully have many, many more with them.